We have the Baby Bold study, which is a study that is an extension of the Bold study. So in the Bold study, we followed preschoolers over many, many years who either have a familiar risk or not of dyslexia. And the question we asked there is, are the brain characteristics of dyslexia already there? Do they predate the onset of kindergarten or not? In that study, we could show that yes, the brain characteristics of dyslexia could be detected as early as preschool. But the logical next question is this developing in parallel and in relationship with language? Or is that something that the baby is born with? And so we are currently doing Baby Bold, which tracks infants all the way from 4 to 6 months to late elementary school. And we're tracking them over time, and we look at their brain development, we look at their language and pre-reading skills. One result that already came out of the Baby Bold study is that infants who have an older sibling or a parent with dyslexia already show differences in the white matter tracts in the brain compared to children who do not have a familiar risk. So the white matter tracts are almost like the highways in our brains. They connect two cortical areas like a highway and make it possible that information can flow from one area of the reading network to another area. And we could show that some of these tracts show alterations in children who have a genetic risk compared to their peers. And these alterations are similar to older kids who have a clinical diagnosis of dyslexia. What we don't know is whether these kids who have a genetic risk actually develop dyslexia later, right? So we have to see what is the sensitivity, specificity of this finding. Is it simply that everyone who has a familiar risk shows these alterations, or is it specific to the ones who then will struggle to develop dyslexia? So that's why we have to track them longitudinally until we know whether they will be good readers or poor readers.